Go back to your labor breathing. Breathe through it. Hey everyone, I'm Sarah Lavonne and welcome back to my YouTube channel. If you talk to someone who's just given birth, one of the things that surprises people is what's called a fundal exam that happens right after you give birth super frequently, and then it'll dwindle as far as like how frequent the exam is. And so I want to talk about what this is. I want to prep you for this because I hear a lot that like, wow, I wasn't ready for that, or like, wow, that was really uncomfortable. And so I want you to understand what it is, why it's helpful, and then give you some tips along the way. So what is a fundal exam? First of all, you have to know what your fundus is. And so when you are pregnant, you have a growing uterus. Your uterus obviously will grow all the way up to your rib cage, fill your abdomen. Imagine that this is your uterus, okay? And so it starts out about fist size, and then as you get pregnant, you grow a baby in here, and so it's gonna fill up your entire abdomen. Now, once the baby's out, your uterus has to go back to that pre-pregnant size. Now, right after a baby, it's not gonna be pre-pregnant size. It takes a few weeks to months for it to go back to pre-pregnant size. Fun fact, it goes faster if you breastfeed. So another benefit, whether you care or not that you're like feeling your uterus or paying attention much to your uterus in there, but it will go back down and shrink because it doesn't need to be so big anymore. And so once baby is out, it's gonna shrink down very quickly. It's gonna be about this big right after birth, maybe a little bit smaller if you've had babies, even bigger. And so you can imagine it started up here and it shrunk down sort of in your pelvis. And so once it shrinks down, remember there was a placenta connected to the side of that. And once it was big, it was connected, it comes out, and then uterus shrinks. What we want to happen to your uterus, which is a muscle, right after birth is we want it to get smaller, because when it gets smaller, what's it doing? Giving you a nice, juicy contraction that is constant. Now, do you feel it like contractions? No, it's not gonna feel like your labor anymore. Sometimes, especially the more babies you have, once you breastfeed, you might feel some cramping, but especially if you have an epidural, you're gonna feel nothing. But we want it to be nice and firm and crampy and hard, because where the placenta was connected has all these arteries and veins, okay? And there's tons of blood flow, up to 700 milliliters per minute flows between you and your baby. We love that when you're pregnant, but once the placenta's out, it's like you sever those arteries and veins. And so it's just a bunch of juicy vessels that are just open to the world to bleed. And so when the uterus goes back and it clamps off, what it does is it closes off all of that bleeding and prevents you from bleeding too much. And so as your nurse, whoever your nurse is, right after birth, and literally like baby can be out, placenta's out, the doctor will probably start there. They will massage the top part of the uterus, which is called the fundus. The fundus is literally just this like top part. And so what they do is they'll have you kind of lean back and they feel and smush into your belly to feel deep below your belly button. It's usually right at the umbilicus or the belly button right at birth. And they're gonna feel that this uterus is nice and firm. We don't want it what's called boggy, because a boggy, floppy uterus means that we're not really closing off those openings where the placenta was to prevent you from bleeding, okay? And so the first line of treatment, one, is for your nurses, it's an assessment. I'm going like, is this normal? How does it feel? Does it feel firm? Does it feel like a softball? And so you can actually feel this yourself after you give birth. Just feel right below, my belly button's right here. I would just push in and you'll feel like a firm softball. That's your uterus. Okay, you can't feel it now. It's your uterus is like, if you're not pregnant, that it would be like in your pelvis. I see someone like feeling inside. There's nothing you would feel if you're not pregnant, but then you'll feel that softball, and we want it to feel firm. If it doesn't feel firm, our first line to help prevent you from postpartum bleeding is to give it a little massage. My uterus has shrunk as we've sat here. Okay, we give it a little massage because that actual physical stimulation on the top part of the uterus helps it to go like, freaking out and I'm gonna squeeze off, and that's all you need to help prevent you from bleeding. So it's an assessment, but it's also the massage, and really it shouldn't be like digging on in there, but I will say labor and delivery nurses are a lot more aggressive than your postpartum nurses, and we get really excited about it. And so we press because we don't want you bleeding too much, especially right after birth, which is your highest risk for postpartum bleeding or postpartum hemorrhage. And so your doctor will feel it, your nurse will feel it, and then they might give it a little massage in order to prevent you from bleeding too much. This isn't gonna cause you to bleed. This will prevent you from bleeding there. Now, the other thing they're gonna do when you're massaging is they want to actually visualize your vulva, which is like your vagina area, to see how much you're bleeding. And so, especially right after birth, we expect there to be a good amount of bleeding, right? Your body adds blood volume to your body as you're pregnant to prevent you from having any kind of signs and symptoms of too much blood loss. So you have some reserve. You can bleed a little bit, but we don't want you bleeding too much. Again, this is a big risk after birth that we're all paying attention to. No matter actually if you give birth in the home or the hospital birth center, it doesn't matter where you're giving birth, this will likely happen. Now, how aggressive it is, flex and flow on that, because that's going to be based on the provider, okay? So they're looking for your bleeding and saying, is there too much bleeding? If there's too much bleeding, our first thing we do is give you a massage in there. And we really want to try to stimulate that fundus, AKA the uterus, to firm up to, again, prevent you from bleeding too much. Now, will you feel this, okay? If you have an epidural, immediately after birth, you will feel nothing. You might feel pressure. You'd like know that they're like, dang, they're like going for it on there. But otherwise, you're not really gonna feel much. Now, as your epidural wears off, or if you don't have an epidural, yes, this is uncomfortable, okay? Now, depending again on the provider, some are a little more gentle, especially if they feel what's going on. I know for me, I'd be like, we're good. I'm looking at the bleeding. You're not bleeding too much. I'm giving you a little rub. We're good. And then that's it. So how long it actually takes to do this assessment / massage, if you're not bleeding, it should be pretty quick. Kind of like I'd go in and I'd go, okay, I'm done. That's it. Okay. Now, if you're bleeding, then we get more concerned and we maybe get a little bit more aggressive and it might take a little longer. Okay. And sometimes we do a little more of a massage and then we're like, okay, we're still good, all right? And then obviously if you're bleeding more, other things happen, all right? If you want that video, let me know in the comment box down below, but that is like definitely a whole other potential series, okay? So again, are you gonna feel it? Yes. And for some, especially once you don't have an epidural, this doesn't feel good, okay? And so I will just sort of give you a heads up that like, it's not great when you have all that sensation and it's hopefully short. Okay. Now, can you refuse it? Of course, I'm always going to give that in there that like, yes, you can refuse anything, but what I want you to do is make an informed refusal or an informed consent either way, so that you're like, I know what this is about. I know that it's important for postpartum bleeding. I do want them as being able to assess to make sure I'm not bleeding too much, and go for it. Do your thing. What I would suggest usually is, and again, your nurses are going to be different on this, but you can always ask for time as they're about to do it. Just say, give me a second. Can I tell you when I'm ready? And then they'll be like, yeah, sure, likely, hopefully. and then they kind of like, okay, you ready? Okay. And then you kind of brace yourself. The more you tense up, the more uncomfortable it is. And so if you can just sort of like go back to your labor breathing, breathe through it. Okay. And that's it. That's all it is. And hopefully then you're safe, your uterus is going back, it's nice and firm, you're not bleeding too much, your nurses have what they need to feel comfortable and know that you're also safe, and then you continue on and you snuggle your baby and that's the end of it, okay? How frequent it's gonna happen, every hospital is gonna be different, every protocol is necessarily different, but usually, and I will say not even usually, I would verge to say 100% of the time it's gonna be more frequent to less frequent. So they will be checking your fundus or doing that fundal exam once you move to postpartum, if you move to a postpartum room or after you give birth for a few hours. But again, likely we're talking like when I floated to postpartum, it was like every shift where I'd go in, I'd do my assessment, I'd like feel, I'm like, we're good. Where's it at? I wanna know how many fingers below the umbilicus or the belly button it is. And that's it. Okay. And again, the hardest, most challenging, most concerned time is right after birth, and then it kind of dwindles as time goes on. My goal for you is that you walk into your birth feeling like, I'm ready for this, and there are no surprises. Obviously, there's a lot to learn, and so if you are ready to learn and own your birth and you want all the evidence-based info there is out there to make decisions for yourself, of course, I'm gonna guide you to the Bundle Birth class. That is my most comprehensive, most thorough, most fun class that I offer, but also you need to know how to cope. I have coping with labor, there's a VBAC class, newborn class, and then obviously my visualizations class also. I have some really fun freebies as well that I will drop down below. There's a free checklist, get that. It's like my little baby of like a 1-pager of what to expect and how to prep for your whole birth. And then there's also a free hospital visualization you can grab down below. As always, make sure you subscribe, like, share it with a friend, comment your favorite takeaway. How did this feel for you? And then learn and look in the comments for each other of like, how was it for other people along the way? And then until next time, don't forget to flex and flow, and I will see you soon. Bye. That's probably plenty for now.